everyone, my name is Jessica Rowe. I'm currently a nurse here in New Bern, and I'm working on getting my bachelor's degree in nursing from the University of North Carolina. I also previously got a bachelor's degree in community health education from UNCW. I wanted to take a minute to thank everyone who took my original survey to help me determine what the biggest educational need was for adults 65 and older here in New Bern. And based on that survey, we will be talking about fall prevention today. So to begin, falls are one of the most common injuries in adults 65 and older. A fall is defined as an event that leads to an adult coming to rest on the floor or other lower surface unintentionally. 1 in 4 adults fall every year, and 1 in 5 falls cause a serious injury. There are many reasons for falls. A few reasons include changes in your senses, such as eyesight or reflex changes. Another factor that increases your likelihood to fall is the chronic health conditions you may suffer from. For example, low blood pressure can make you feel dizzy. Low blood sugar from diabetes can also make you feel dizzy. If you suffer from neuropathy, which is tingling in your hands or feet, you may have a higher chance of taking a misstep and falling. Medications also increase your likelihood of falling. For example, pain medications, allergy medications, and anti-anxiety medications can make you feel drowsy. Blood pressure medications can lower your blood pressure and make you feel dizzy, especially if you sit or stand too fast. If you're unable to control your bladder or take medications that make you urinate more, or you need to go to the bathroom frequently, you may be in a rush to get to that bathroom, which can lead to falls. Memory changes can also leave people confused or disoriented. And if you have safety hazards in your home, such as cluttered walkways or low light, you may be at a higher risk of falling. Finally, we tend to lose muscle mass as we age, so this also increases our likelihood of falling. One of the biggest things that we can do to help prevent falls is fall-proofing your house and fall-proofing your environment. So the first area in your house that we will talk about is your bathroom. In your bathroom, it is beneficial to place grab bars near your toilet, around your shower, and in your bathtub. It is also important to place non-skid mats in areas that are often wet, such as in your shower and right outside your tub. Placing a nightlight in your bathroom will also help prevent falls in the middle of the night. The second area we will talk about is how to fall-proof your floors, stairs, and hallways. If you have stairs in your home, handrails should be placed on both sides of your stairs. Keeping your walkways tidy greatly decreases your risk of tripping and falling. And one of the biggest factors in tripping is throw rugs or area rugs because these tend to bunch up and are easier to trip over. The third area in your house that we will talk about is your kitchen. It's important to place your most used utensils, pots, pans, and other supplies in easy to reach places. This will prevent you from having to reach high or bend low, which increases your risk of falling. At that point, your center of gravity can be off balance, so you're more likely to fall. If you tend to spill stuff or if you spill something, make sure you clean it up immediately to avoid slipping. And then finally, it's important to check in with yourself and determine if you are becoming tired. If you are becoming tired, you should allow yourself to rest or finish your tasks while sitting. The fourth area of your house that we will talk about is your outdoor spaces. It's important to inspect your stairs and sidewalks for unevenness and cracks that could potentially trip you. Adding non-slip adhesive tiles to your outdoor stairs will help you keep traction, especially when your stairs are wet. These can be purchased at local hardware stores. Keeping your outdoor walkways, lawn, and deck free of debris will also help prevent you from tripping and falling. And then finally, we'll talk about some other considerations when trying to prevent falls in your living environment. One of these includes keeping wires or cords out of your walking path, arranging your furniture in a way that promotes straight, clear walking paths, utilizing a grabber to reach high up items like the one pictured, and staying aware of your pet's location because they easily can get under your feet and trip you. The second to last topic we will talk about is staying fall free. Staying active is one of the most important ways to stay strong and healthy. Exercises such as yoga or Pilates will help build strength and balance. And another great way to exercise is to do chair exercises. There are many YouTube videos on chair exercises that you can do in your home. I know the Craven Senior Center also has chair exercise and stretching classes, among many other great classes and resources for you. Making sure you get proper nutrition is another way to help you stay strong. A balanced diet will help your energy and strength levels, and it's also important to make sure you're getting enough calcium and vitamin D to keep your bones strong. Another great way to stay fall free is to make sure you have your hearing and eyesight checked regularly so that if you need glasses or hearing aids, they can be prescribed for you. If you are someone who needs to use an assistive device such as a cane or walker, it's important to make sure that you're using these correctly. Incorrect use can lead to you falling. I know there's also great videos on how to use these correctly if you're curious. Supportive non-skid shoes are another great way to prevent you falling. You are less likely to slip if you have good shoes on. You hope you have more support. So it's important to have these things. And then finally, it is important to make sure you have a life alert or that you keep your cell phone on you. If you were to fall, it is important to have a list of favorite contacts in your phone so that you can reach people easily. And then setting up daily phone check-ins with family or friends or neighbors is another way to help keep you safe. If someone calls you at the same time every day and you're unable to answer or you don't answer, then you know you have someone coming to check on you, so you won't be stuck on the ground. So the last and most important topic we will talk about is what to do if you fall. The first thing to do is to remain calm and take a deep breath. I know this is easier said than done, but it will help you think clearly and make a game plan. Next thing you should do is to determine if you're hurt, and if you are able to, crawl to a chair, roll onto your sides, and then slowly get on your hands and knees and lift yourself into the chair. Make sure you give yourself time to adjust. You can drop your blood pressure, your body's in a little bit of shock, so it's important to do this slowly. And then if you are hurt or you're unable to get up, it's important that you call someone, either friend, family, neighbor, ultimately 911 if you need to. That's why they're there. And this is another reason why it's important to keep your cell phone on you or wear your medical alert device, such as a life alert. Again, I just wanted to thank you guys for listening to my presentation. There is a survey that I will have posted. If you guys could please take the time to take it, it helps with my project. And I hope to be more active in the community and maybe come talk to you guys in person about this stuff as well. These are just the references I used for my project. Again, I wanted to thank you guys for taking time to listen to my presentation, and if you could take the survey, I would greatly appreciate it.